Hello, hello. Welcome to the 360 Method, a podcast where we chat about everything Autism 360, talking about what's going on in the program, chatting with program members, team members, and talking all things mindset, as well as exploring relevant ideas that autism parents think about. I'm your host, Ella Bailey. I'm an Autism 360 veteran coach and explorer of all things parenting support. Today, I am super lucky to be joined by the talented and delightful Erzgul, one of our senior speech pathologists here on the program. Hello.
Hello, Ella. Thank you for that wonderful intro.
Oh, that
How
is
are you?
I'm so good. It's lovely to have you, and it's lovely to be able to chat with you and kind of welcome our lovely listeners. We are so listener focused here at the 360 Method, and we want to hear from you. We want to hear from our listeners about their thoughts and experiences. So please do drop us a line at hello@autism360.com. Whether you're a program member or not, we would love to hear from you. So before we get started and before I start to pick Erzgul's brain, I do just need to give a disclaimer that this podcast is not substitute for medical advice. If you do have concerns about your child or their speech development, please do seek medical or allied health support. I'd also like to acknowledge the Gadigal people of the Eora Nation, on whose land I live and work, and from where this podcast is being broadcast today. So today we are busting speech therapy myths with Erzgul, our delightful senior speechy here on the program. It's so good to have you.
Thank you, Ella. It's so good to be here.
Yes. And so, I mean, in all your years of speech therapy, you must have heard some wild, some myths, some wild facts.
There are a few floating around, yes.
Yes. I'm gonna round up a few good ones, and we might get started with one of the most common ones that I found. So this is a speech therapy myth that baby talk will inhibit language development. Have you heard this one before? What do you think?
Yes, definitely. And look, the short answer is that no, it won't. But let's talk about what does that baby talk look like. So what does it mean when we say baby talk? So believe it or not, Ella, there is actually a thing called motherese or parentese. Have you ever heard of that before?
Yes, I have heard of that before.
Okay, fantastic. So basically what that refers to is how we as adults actually change the way we communicate with our babies. So from early on, we naturally do it. Maybe some of us do it more than others. But what we tend to do is we will change the tone of our voice. We might speak at a slower rate. We might repeat more and use simpler vocabulary. So it's actually a thing that we do, and it helps kids. So if you think about, even yourself, or if parents are listening at the moment, if they think about maybe how they've referred to their children. I know early on with my kids, even when I was changing their nappy, I'd be like, oh, let's change your nappy, and I'd pause between, and you kind of just talk as you go. And so that's the technique that we're talking about when we're talking about baby talk. And it's definitely been found to actually help babies, but even young children. So if you think about it, when we do that type of talking, we're emphasizing the key words. And what that's doing is it's almost like a light bulb. We're putting on a light bulb and going, flash, flash, important word here, pay attention kind of thing. So it really does help.
That is interesting. I used to work at a psychology research lab before I worked here, and we were doing an international study on what we would call infant-directed language. So this exact thing, baby ease.
That's right.
Yeah, and it turned out that every country that we were receiving data from in their own languages did this thing. They, directed their speech differently, their fluctuation and intuition, intonation was different, except for one country. Do you know what country that is?
Was it the African countries? No, I could be wrong.
Nope, it was Germany.
You
Yeah,
tell me. I'll learn. What? So
it was
so
Germany.
what was? It was Germany.
Yeah, so interestingly, the German language doesn't use infant-directed speech.
Wow. Well,
Fascinating.
that's news to me.
I know. Now, it was news to us too when we were researching it. I know.
Wow.
Super interesting.
That's really interesting. Look, and you know what's really interesting is that we're almost pre-wired to do this. It's just it comes naturally.
Mhm.
And I guess the one thing to think about though when we're referring to the baby talk is that it's not baby talk as in using made up words with our children. So that's something just to be cautious about. Sometimes I hear, or I may have even used them years ago, but just with the words we use, it's really important not to make up the words. So like not to say bot for a bottle.
Yeah.
If and especially if our child's making an unclear sound or a word for something, it's really important to say the correct word back to them so that they have a really good example of what the correct word is.
Yeah, absolutely. And I think that's something I'm presuming that's particularly important for a child whose language or communication development might be atypical in some way.
Definitely. It applies for all, because if you think about it, at the end of the day, it's about communication, and we all want to be understood. So if we have a consistent form that we're using, so we're consistent with the words, we're exposing our children to those words that they're going to hear somewhere else as well. So we're only going to be helping their understanding.
Yeah, totally understood. I guess that kind of leads interestingly into our next speech therapy myth that we're either going to bust or affirm, and that is using telegraphic speech. So does that help young children to talk?
Yeah. So what is telegraphic speech? Should we first maybe talk about that?
Good question. Absolutely.
Yeah. So telegraphic speech is when you're using only sort of content words, not using the grammar that belongs in the sentence. So an example might be something like "wear shoe" instead of "where is your shoe," or you might say "daddy car" instead of "oh look, there's daddy's car."
Yeah.
Okay. So what they've actually found is that there's been some research around this area, and what they've found is that if we don't use those important smaller words and the grammar in the sentences, we're really depriving our kids of a rich language environment. And interestingly, actually, in the autism space, they've looked at this as well, and whether autistic kids benefit from telegraphic speech or not, and they've found that the same applies regardless. We need to expose our kids to the correct structure of the language with the correct grammar, with the words in there. So what we can do is, how we talked about with the baby talk strategy, we're emphasizing the key words. What we can do is we can still use our sentences, but emphasize those keywords, the important words.
Yeah, interesting. So, oh, look, it's daddy's car.
Yeah.
Still
Or like say, we were saying, oh, do you want a drink?
Mhm.
Oh, here's your drink. So I've sort of emphasized those keywords. And look, there's no reason why you can't hone in on that actual, particular word once you've said the sentence as well. You can do that as a bit of a repetition. So there's multiple opportunities to hear the word. But really important not to use that telegraphic or robotic speech. Sometimes we refer to as that as well. So, but keep it simple.
Yeah.
So even though we're saying use grammar, use sentences, we don't want to use a huge long sentence when our child is probably able to understand, shorter, simple sentences. And always, I think, just on a side note, I think it's really important to remember that us adults, we talk a lot faster than young kids. We use a lot more syllables, a lot more words. So we need to sometimes slow down as well. So, between sentences too. I think that's really important. And that also gives our children time to process what we've said and to understand it. And it gives them also a chance to respond if they want to.
Yeah, awesome. I love those tips. And it makes me want to ask one of these next speech therapy myths. And one of them is I should insist that my child repeats a word after me. What do you think about this? Oh, I'm seeing a speechy head shake on that one.
I would have to say I totally disagree with that one.
Okay.
And I'll tell you why.
Yeah.
If we think about communication, it's so much more than just words. Okay. So if we think about it, there's our receptive language, which is our understanding of what other people say. And then there's also our expressive communication. So how we express ourselves to get our needs met.
Yeah.
Now, there are many ways apart from just speech. So before even your first word, you're communicating. Well, with our kiddos, sometimes I suppose the eye contact can be a little bit difficult, but that is one form. Pointing is another form of communication. And again, sometimes our kiddos can have difficulties with pointing, but they might pull you, or they might drag you to the thing that they want. So they're really still communicating. So I guess what I'm saying is that we need to probably shift our focus off the words and focus more on the communication intent. So what is my child trying to convey to me? And if you said to me, why shouldn't I insist on my child saying a word or repeating after me? Well, one, maybe they don't know how to repeat after you yet. Or maybe it's difficult because for some of our kids, they can have difficulties with the motor planning. So with the muscles, executing the movement. So if that's the difficulty, then it's going to be really hard for me to get the words out. But if there's another way that I can show you, then you need to respond to that rather than insisting that I say something. Because I always say this to parents, if your child could, they would. Okay?
Totally.
And when they can, they will.
Yeah.
Okay. So I guess it's really about respecting that and being patient, giving other ways for our children to convey their message and not insisting on them saying a word.
Yeah, interesting. I feel like the next one is another thing that people will often do if they're trying to find some way to really promote their child using spoken language as their primary form of communication, and that's the use of flashcards. So one of our primary speech therapy myths is using flashcards promotes language development. What do you think about that? What have you seen in your practice?
Yeah, look, first of all, I have to say that, visuals can be very supportive of communication. So visuals, using any type of visuals, so using objects, using your gesture, your body language, and pictures sometimes, or even a device. So any type of visual is going to support your communication. But if you're referring specifically to flashcards, I hold up a flashcard, I make my child say the word kind of thing, there is no evidence to suggest that it promotes language development.
Yeah.
And especially because when we think about, Ella, the way that we learn language, it's actually through natural interaction.
Yeah.
So if we're naturally interacting with our children, if we're doing something that's meaningful, if we're doing something that they enjoy, that's when we're going to actually promote that language development, not making them look at a flashcard and say what's on there. Now, that doesn't mean you can't use flashcards. You can use them. You can point to the picture. Maybe you can talk about it. If your child's interested, they enjoy it, you can do that. But there's no evidence to say that it's going to promote their language development. And what I would recommend, if parents are saying, well, then what do we do? How do we get our kids to, how do we promote their language development then? What do we do? And I would say play with your kids.
Yeah.
Language develops through play. Now, I know that some of our kiddos can have their own way of playing, but it's about how do we get ourselves involved in their play? So rather than, trying to get them to play with something that we want to focus on, let's follow their lead. let's try and look at what they're interested in. Let's try and do something that they're doing. Maybe if we copy them, we might grab their attention. Maybe they might engage with us then, and then we can say a word or do another action and see what happens. And it's about building the, I guess, the two-way process of communication, or that reciprocal turn taking and playing and having fun together. That's what's going to develop the language. And I guess the other thing too is that you don't have to always play. I know we're busy. Sometimes parents will go, oh, I don't, I work, I don't have a lot of time. And I understand that. And that's where I guess it's about thinking about, how do I incorporate some of this language strategies, or how I can engage with my child, maybe during a routine. So maybe during, bath time, let's talk about things in the bath. Let's, do something fun in the bath. Or it could be during a meal. It could be during, I don't know, getting ready for school, putting their shoes on. There are so many opportunities that we can use to help develop language.
Yeah, interesting. I feel like that change in headspace can be really tricky for parents. They feel like the only way that they can have a helpful impact on their child's language development is that really rigorous kind of tabletop setting where you're, using flashcards or whatever it might be. But it almost feels like that's going to be much more fun, for both parties to be able to
Yes.
play, relax,
Yes.
be natural about your interactions. Oh my goodness. Absolutely.
Yeah, definitely, Ella. And I always say, I have my little sayings, and I always say, for communication, you need to have motivation. Okay. And it's not just for our kids, it's for us as well. There's an intrinsic motivation for us to do things. And same goes for our kids. So just think about it. If it's fun, the child's going to be paying attention. They're going to be learning anyway. But if it's not fun, then that's not going to necessarily be happening in the same way.
Yeah, no, you couldn't be more right. And I think this next myth kind of illustrates, or maybe depending on what you think about it, illustrates a bit of that mindset shift, especially that's gone on in speech therapy over the past few decades. And that is speech therapy is done in a therapy room. What do you think about that?
Yeah, look, I've been a clinician, my background is speech pathology, for more than 20 years. And obviously a lot of that was spent in the clinic room.
Totally.
But I have to say, on reflection, I think the biggest impact that my therapy even had was when I trained other parents, and when I went into their homes and supported them at home, or when I supported kids at kindy. So what I would have to say is that speech therapy isn't just done in a therapy room. It's actually, it can be done anywhere. And I think it's also about having that mind shift about instead of a therapist doing the therapy, seeing yourself as part of that and part of that team, and seeing yourself as like a therapist. And the fact that you can make a change. I mean, there is so much evidence out there in terms of early language development and the role that parents have to play. And what they've found, particularly, I don't know if you've heard of the Hannon program, Ella, but have you heard of that? Yeah. So they've done a lot of research around early language development and the interaction between children and their caregivers or their parents. And what they've found time and time again is that if we as parents shift how we respond to our children, if we get down to our child's level, if we respond to them at their level, we can actually make the biggest change. And this has been shown. So it's very evidence-based. We know that parents can make a difference.
Yeah.
But it's just having the right strategies.
Totally. Absolutely. And I mean, that's our bread and butter, isn't it? That's what we do day in, day out. We help parents to know that they can be the change, that they can have an input. They don't have to feel alienated from their child's development process. Is the Hannon method the one that's called It Takes Two to Talk?
Yeah, they have a few different programs, Ella. So with if we're looking at typical neuro diverse sort of different populations, It Takes Two to Talk was one of the early ones developed for sort of the let's say typical language development. And they have what's called a More Than Words program, which is more specific to our autistic kids and families. So they've sort of expanded on the strategies or made it more relevant to our kids, because obviously there is the difference in the communication. And they can be really effective, the strategies. So it's amazing what knowledge can do. I think once we know, then we can really be the change.
Oh, absolutely. Once we know better, we do better, right?
Yeah, for sure.
Absolutely. We've got our last myth to bust here. And it is that learning two languages at a time, bilingualism, causes language delays in young children. Thoughts?
Now, I would have to say that's a big false.
Yes, amazing.
So learning two languages, in fact, learning more than even two languages at a time, does not cause language delays. If we're going to have a language delay, it will probably affect all the languages across the board. So there's no evidence to suggest that speaking another language will cause a delay. And in fact, what they've found is that kids who are exposed to more than one language have what we call better metalinguistic skills. So if you think about it from a higher thinking, sort of more flexible thinking level, because if you think about it, when you speak one language, you have vocabulary in one language. When you speak more than one, let's say two, you may have another word that represents the same thing in a different language. So you're learning that, oh, wow, that can mean that thing. So, so short answer is no, bilingualism doesn't cause any language delays. And I have to say that, I think it's really important for families that are bilingual, particularly if English isn't their first language. I really encourage the parents or the families to use their mother tongue, because what we find from a language perspective is that if you're using a language that you're less fluent in, you're not as comfortable, you're less likely to talk, and you're less likely to do the normal things that you would say if you were comfortable in your mother tongue. So, for example, singing songs or, nursery rhymes, or just talking to your child. So I always encourage families to use their mother tongue if they're most comfortable in that. Now, if you want to use both, you can as well. We say try not to mix the words in the same sentence where possible, purely because every language has its own grammatical rules, I guess, from that sense. Yeah. But you can repeat it in the other language. But, even, I suppose, the thing is, even when we don't mix, we sometimes find our kids mix the languages. And then sometimes parents will go, well, does that mean my child's confused? The answer is no, they're not confused. Actually doing something really clever. Have you ever heard of something called code switching or code mixing?
Yes, I have heard of that, but not in this context.
Oh, okay. So it's actually when we will switch from one language to the other when it's easier to access the vocabulary from another language. So kids will often, if they're exposed to more than one language, they might mix the two languages together. And sometimes we're led to believe that our child's confused when in fact they're doing something really clever with their brain. They're going, okay, I know this word from this language, that word from that language, I'll just put it together and there's my sentence. So that's really a clever thing that they're doing. And so that's not a reason to stop speaking to your child in another language. If anything, they're doing a higher level thinking skill. So that's really awesome if you do see that.
That is awesome. I did part of my internship in Copenhagen, and I mean, one of the well-known things about Scandinavian countries is that they are very bilingual. Everybody learns English and is very comfortable in English. But what they noticed is that, and I mean, I was in Denmark kind of thing, and so the examples that I'll use are Danish and English, but that kids would grow to kind of 7 or 8 doing that exact thing, code switching between Danish and English in sentences, picking up, you know, having a full sentence of Danish but an English word that they want to use to describe something in the middle. And then at about 7 or 8, dependent, you know, when the kiddo is developmentally ready, they kind of then seem to understand and extricate the two languages and use them in context, you know, context appropriate ways. Is there something in that about the research? What's that about?
Yeah, look, I'm not sure about the ages, I must admit. I haven't, you know, checked on that, but I can definitely do that for you. But I do know, in terms of the languages and I suppose the exposure to those languages, sometimes what can happen is that if you're exposed to, say, like a particular language in a particular country for certain hours of the day, and then you may be exposed to another language, let's say at home or what have you, so it's not as I guess frequent, or the hours are less, you are still bilingual, or you're still understanding, but you may be what we call like a passive bilingual, so you understand one language, but you're stronger in the other language, so you tend to speak that language more. So I'm not sure if I'm answering your question, particularly, Ella, but, you know, that's an interesting finding in itself. And look, I just want to say something about bilingualism, particularly for our kiddos that are nonverbal.
Totally.
Because, you know, what if the parents are saying, well, my child doesn't use any words, you know, can I still speak to them? And yes, you can. Yes, you definitely can, because remember, it's about enriching our child's environment. And sometimes our children understand more than they can say. So just because they can't say the words doesn't mean they don't understand it. So we need to still be exposing them to that rich language. And if you think about it, when you're comfortable in your mother tongue, you're more likely to engage with your child on many different levels. And there are also going to be, if you think about connections and family and extended, you know, like grandparents and what have you, it's going to open up another world for them. So even if they can't speak, they're going to hopefully understand and pick up on some of that vocabulary that we can still support. So it's really important from an understanding point of view. And I just want to quickly share something, Ella. I remember years ago, I used to visit a lovely family, and it was the family was from a Chinese background, and so they were bilingual, so they were exposed to, you know, Mandarin and English. But what they had done was they were told to speak in a single language, so they had spoken to their child, their autistic son. I can't remember how old he was now, but only in English. However, they had been speaking to each other in Mandarin for all this time. And then one day something happened, and then they were speaking in Mandarin to each other, and their son turned around and responded. And now they were shocked, because they thought, well, we haven't spoken a word of Mandarin to you. How do you understand? Well, if you think about it, he was exposed to that language all his life. He'd heard his parents talk the whole time. So that just shows, just because they weren't teaching him directly, he was exposed to it. He was in an environment where he heard that language and he understood it.
Isn't that amazing?
Yeah, I think that's amazing.
Oh, how cool. I've certainly heard stories about kids learning Spanish from the internet. Just there's media, there's bilingual media and that kind of thing. And all of a sudden they're speaking Spanish, and their parents are thinking, well, we didn't teach them Spanish.
Yes. Oh, look, that's an interesting point you make, Ella. Actually, one of my parents was asking that the other day, because she was finding her child was preferring to watch videos in other languages. And so and I'm hearing that more and more, you know, like preferring Russian when you haven't spoken.
I've heard that. Yes, I've heard specifically Russian.
So I don't know what it is about the intonation of that language, but it seems to be that for some of our kiddos who maybe have preferences from a auditory, sensory point of view, maybe they're preferring to listen to the flow of some of these languages.
That is so interesting.
Yeah, it's really interesting. And I'd love to hear some more research in this space, because it's obviously just coming out in, you know, recent years because of all of the access, I guess, with the devices and the technology. So, but I wouldn't be concerned. You know, sometimes parents will say, oh, should I stop my child from watching a video in another language? I would say, look, if they're enjoying it, you can still watch it. Maybe you can sit alongside them, have a chat about what they're seeing, what's happening. So, you know, don't worry. But, and just, you know, obviously, as long as you're exposing them to other experiences and play opportunities and talking to them, then I wouldn't be too worried about a video here and there in another language.
Yeah. Amazing. I think you're right that it must have something to do with the increase in access to all this different types of media and the YouTube rabbit holes.
Yes, yes,
definitely.
Yeah.
We're gonna answer one of our lovely listener parent questions now. So this one I thought would be super appropriate for you, and it is from Sarah from Launceston, who asks or says, I'm worried that using signs or pictures to communicate will inhibit my child's speech development. What are your thoughts? And this is just a straight handball to you. Go for it.
Sure. Look, I totally understand. Sometimes parents can be reluctant, you know, moving towards, I guess, a non-verbal way of communicating.
Yeah.
But what the evidence and the research tells us is that actually, if we provide those other means for our children to communicate, so things like it could be keyword signing, it could be gesture, it could be pictures, photos, devices too, communication devices. All of these things will actually not inhibit their talking, it will facilitate. So if anything, it's going to help speed up that process. Yeah. So, and the reason for that is if, again, I'll go back to, remember I said communication, you know, it's more than just talking.
Yeah.
So there are many ways that we communicate a need. And so if we can provide these other ways for our kids to communicate, it's going to help them, because it's not going to just help from a talking perspective, it's going to help from an understanding perspective. Yeah. And the reason why I say that, Ella, is because if you think about it, we take language for granted. We talk, we speak with words. But if you think about it, it's very abstract. You know, I say a word, it's gone. Now, our kids, they may need a bit more time to process, to make sense of those things. Now, if it was something I could see and then I heard the word, that's going to help me to remember. It's going to give me more time to process the meaning. And if I can see that thing, so whether it's a picture or whether someone signs. So, for example, you say finished, I said the word, it's gone. If I say finished, you can see it, you can hear it, and it's giving you time to process and make sense of it. And imagine seeing that, hearing it all the time. That's going to help you make a connection with meaning. Or with a picture, or sometimes I say even with an object, you know, use objects for meaning as well, because if you connect any sort of thing that I can see with your language, with your speech, you're going to help me understand. And remember, if I understand, then I'm more likely to come out and use that thing. And again, just on a side note, Ella, remembering that some of our kiddos can really have a difficulty in terms of getting those muscles moving in the way that they want to get verbal language out. So the reality is it may be difficult for some of them. And so we need to give them those other ways. So signs and pictures are actually a perfect way to do that.
Yeah, absolutely. And it sounds like there's a bit of a gold mine there that we might have to get you back on again soon to chat about that kind of motor planning issues with speech.
Well, anytime.
Yes. Oh, thank you for coming and chatting with me. I appreciate it.
It was a pleasure. Thank you.
Yeah, and I want to let the parents know that every time we get a coach on to chat to you guys and bring their expertise, the company donates a day of access to a computer literacy course for Indigenous community in remote Australia. So that's just an added bonus for getting you on here, which was
awesome
as well.
That's awesome. Thanks, Ella.
Oh, that's my pleasure. Thank you for coming. And we will chat again soon.
Bye.
Bye.